The topic that I decided to write my paper about was the challenges and the considerations of working with patients who are bisexual. Bisexuals are dealing with so much as they go through their day-to-day lives. They are mistreated, judged, talked about, made uncomfortable, and so much more than we could ever even understand. These things make it very hard for bisexuals to live the normal life that they want, which can sadly lead to mental health problems down the road. The way that bisexuals are treated makes it very hard for them to want to go out and to do everyday things, such as going to your healthcare provider when needed. A lot of bisexuals are nervous about going to see their provider because they are scared that the provider will either mistreat them or judge them, and that should not be the case. Going to see your provider should be your safe place because at the end of the day, they are only there to help you and to make you feel better. As of right now, healthcare providers are not required to be trained when it comes to handling patients who are bisexual, but it is slowly becoming more and more encouraged. The more the healthcare provider knows, the more comfortable they can make their bisexual patients, which can go a long way. Healthcare providers without the correct training and education often face many challenges when it comes to the care of the patients who are bisexual. When healthcare workers sign contracts for their jobs, it is now their responsibility to produce excellent patient care that goes above and beyond the needs of bisexual people. Healthcare environments should be a safe place for the LGBTQ community, a no-judgment zone, and a comfortable communication spot when it comes to the patient and the provider. When a healthcare provider has a sense of kindness and respect, it will lead to better quality care and better communication and better trust between the patient and the provider. When a patient feels secure and comfortable with their provider, they are more likely to open up and discuss what is going on, which will lead to much better communication skills between the patient and the provider. This will also make the patient more comfortable when it comes to scheduling their appointments when needed, instead of waiting it out because they are scared that they will be judged or unheard. People who come from bisexual backgrounds tend to deal with many more problems than people who did not come from that type of background. Bisexual people deal with a lot of mental health issues, including depression, anxiety, and suicidality, which means that they are some of the main people who need to get the help the most. But sadly, they are scared to ask for it because they are scared of the way they might be judged or treated, which should not be the case. The prevalence of the population that identifies as bisexual is around 7.2% in America and will most likely continue to grow, which is why providers need to be educated on the challenges and the considerations of treating their patients who are bisexual.